Hello, dear friends. Thank you for viewing. Thank you for joining me today as I wrap up the last 6 days in my recovery, such as it is, from Labiaplasty with Dr. John Stranix at UVA Medical Center in Charlottesville, Virginia. So, if you haven't watched the previous videos, it's been a disaster. Please check those out. I won't go into all the details. I will say I've been trying to do whatever triage I can. I've been calling around all of the patient advocates, patient relations at the hospital. I've been talking with the plastic surgery manager of the department at UVA, and he's going to join me for the meeting with Dr. Stranix the next time, and I'm also going to have my sister come and join us. So hopefully that will be enough moral support for me to get through the long list of questions I have for him, which is extensive. I wonder if I should put it in the notes. It's a little extreme right now, so maybe I'll dial it back a little bit because it has, honestly, it sounds extreme because I've been so emotional because I have been suicidal based on the situation. The pain isn't quite as bad as it was, thankfully. That is getting better. They have increased my gabapentin pain medication, but unfortunately that seems to be making the numbness worse also. I have been experiencing more pain around the belly area where fat was extracted, and in some ways that soreness is a positive thing because it's been numb for a while, and it still is fairly numb through my belly, the bottom of my belly, and I'm still kind of rather dysphoric about how the shape of it has been changed to be more masculine. Been talking with patient services, and I was told, actually, so has the manager in plastic surgery, and since I can't really resolve it with plastic surgery, they're going to have me file a written grievance, and I'm in the middle of doing that now. I talked with somebody today about that, so we'll see how that goes. Basically, the hospital will review it to see if the care was proper or not. I've also contacted a certification firm that certifies the hospital and put a report in there. And I was so upset that nothing was being done and my nerves were getting worse and worse that on the advice of one of these patient outreach places, I got an appointment at primary care, and since my physician's out on break right now, I saw another physician there who also specializes in trans care, and she was really horrified at my situation and gave me a prescription for titrating up the gabapentin to be more effective. But she couldn't really do anything for all of the numbness. All she was able to do was prescribe pain pills. And this wasn't something I liked because I was feeling rather desperate because of all the nerve damage I've undergone. Because all of the skin from the top of my penis that has withered away to nothing has completely, since it's disappeared, it's triggered a lot of nerves, both from around the portion of the penis head that was turned into my clitoris, as well as the whole shaft of the penis that it was attached to, where all of the erectile tissue was taken out. And so I can feel the pain of that missing erectile tissue too, so there's a lot of amputation pain. And that's still there even with the gabapentin. There's still pain around my clitoris. And I don't know if there's anything that's going to be able to do for that. And I don't really care. At least pain is better than feeling nothing at this point. So I guess in some ways I don't even know if I want to take the pain medication, because I would rather be in pain than be numb. At least then I know there's a nerve there that's working, sort of. It's difficult. And then the day after that, I talked to plastic surgery, and the situation was so bad that I was recommended to go to the emergency room because there was no way to see anyone else. I'd been referred to pain management, but pain management was unable to make an appointment for me sooner than 8 weeks out. And I was concerned that things were just going to get worse if I waited that long. So, I mean, I don't know what pain management can do for me, honestly. I don't really know what they do. And at this point, managing the pain is not the issue. The issue is that I've lost a huge amount of sensation in my vulva, and I don't know if I'm going to get it back. So I went to the ER, and I saw a doctor there, the general doctor, and because I also have chest pains, they ran an EKG as well. But everything else is pretty normal, and eventually I was able to see a plastic surgery resident, but she said basically, with nerves, there was nothing she could do. The only thing they can do in plastic surgery is more reconstruction, which is what got me into this mess in the first place. So, yeah, she was kind of on the same boat, just more pain pills, more gabapentin, and she was very, very sorry that I had to go through this. And so am I. I don't know how this managed to be my path in life. I really don't. It's bewildering to me that the doctor could be so overconfident to not tell me that this was a possible outcome. But, I guess that's just more fodder for me in court. I really wish I had recorded all of those conversations with the doctor previously. So that's a pro tip. Always record the conversations with your doctors if you're in a state that allows that, like I am. And so that was it. I skipped the day of work, basically, because I had to go to the ER. How unpleasant was that? So unpleasant. But at least I know I did what I could. I've made all the efforts to try and get this fixed as best as I can when the medical system doesn't really respond to things quickly. I mentioned earlier that I would have gone to the ER, but I know they didn't have neurologists there, and that was confirmed by the ER doctor when I was talking to him. So, I just keep hearing, you're completely screwed, so all I can do now is find a lawyer and pray to God and the angels to take me to a higher place and move past it. I honestly don't want to go to court. I've had enough of all of this. I've had enough of this life. It's just been so exhausting. I just want to go to sleep and not wake up. But I am going to stay alive to at least let Dr. Stranix see the horror that he's wrought upon me and take him to court, I think, if I can. And at least I'll be letting all of you know, gentle viewer, about all of the pitfalls you might want to avoid in the future. I love you. May all of your surgeries go perfectly. May all of your surgeons be perfectly honest and not sugarcoat anything, and tell you all the details about every single cut with the scalpel, just so we really know what it's going to come out like. Make sure they explain in detail every last little bit, and make sure you know every single possible bad or good outcome that could come. Make them take all the time to tell you so you don't wind up in this horrible position that I'm in. I love you. Aloha.